All right, another use for our pelvic harness is to help with rotational movements. It's great for adding resistance to things such as like a baseball swing or a golf swing, helping drive those hips, recruiting the hips, because so many people, when they swing, they kind of don't have that neuromuscular control. You'll see people that swing a baseball bat and they don't, you know, as they say, squash the bug. They just, for some reason, can't make that kind of mind-muscle connection and squash that bug, come around, bring those hips in and get some power to a baseball swing or a golf swing. So this is a way you can actually help with some rehab with opening and closing of the hips and help improve somebody's golf game or baseball swing. So the way this is going to work, we got the performance station anchored, J-hook anchor set at her waist level, same level as the pelvic harness. We want to give resistance for the right-hander. We want to resist this hip rotation so that it's strengthening it, making them recruit it. So depending on how much resistance you want to do, you can come step out here. You can clip all the way over here and bring the Slastic around the body, depending on what the needs are. Step on out. So as you see now, it's putting a rotational vector onto the pelvis. We're not twisting the torso, we're not twisting any of that. All this force is trying to rotate that pelvis back this way. So when she go ahead and do a baseball swing, she really has to drive those hips through, and it really gets that mind-muscle connection in there for opening and closing of the hips. Golf swing for me. Okay, so, you know, golf coaches out there, or, you know, some of the doctors or physical therapists who are really into golf and do some golf coaching, you know, you can kind of go through this a little bit, slow somebody down, clean up their motion, coach them through it, add the resistance. Because then when you take it off and you have them go through the motions, especially with progressive resistance, it really activates that whole chain and people tend to feel like they're spring loaded. You see instant improvement in their driving distance, things like that on the golf course. So go ahead and step back for me. If you want to decrease, if they're kind of a novice or they really don't have much control, just go ahead and hook it right to this hip. Then you're not really, you're giving a little tug, but not trying to really spin them like a top. So go ahead and go through those motions. So, and then that's not as much rotation. You can progress and keep looping all the way around. With this also, if you've got somebody who maybe walks when you do a gait analysis and they, you know, they're walking with their alignment off, and you notice that they're walking crooked and they kind of have that, their pelvis is around the left, but yet they walk forward, you know, with an external rotation of this femur, internal rotation of this femur, but yet they're walking straight. You can go ahead and hook to one side, whichever side is the weak side, and have them just march back and forth. Go ahead and walk backwards to no resistance and forward. And that's giving them that tug into the side of weakness, so then you can strengthen that and hopefully help correct a little bit of that gait issue if it's geared around the pelvis. Again, you can make it tougher by bringing it all the way around. I mean, we can come all the way around to that side if we want and really make this hard. Okay, go ahead. So that's really tugging on her. Watching their gait, making sure that that pelvis is still facing forward as they walk. So it's a great tool, very versatile, vertical assist for activities of daily living, like getting out of a chair, maybe going up 1 step or 2 steps if you have those in your clinic, and a little bit of gait therapy as well. So we just went through kind of gait training, potential usage for the pelvic harness, baseball swing, golf swing, vertical assist. Another aspect for the golf swing and the baseball swing is the eccentric training of those hips. What we want to do is actually increase the amount of acceleration of the hips opening up, actually kind of turning it around on somebody where they got to eccentrically control this, the hips driving around, because we're going to pull with that direction. And so if they don't control that hip, those hips, they're going to over rotate. So it's kind of a little bit of a mind game to play with the body and help train in some better control. Eccentric contractions, eccentric control always is superior for gaining more strength and control. So let's go ahead and hook her up here as if she's a righty, and we're gonna help her spin around faster. So when she drives through, she has to actually slow her hips down as they come through. Again, it's controlling not only the concentric action of coming around, but that eccentric or deceleration control as well, which is really helpful because you don't want to step in the bucket or over rotate with your golf or baseball swing. So kind of a neuromuscular control application here.